occasion. We're excited to celebrate another in-person College of Medicine investiture. I would like to recognize those on the stage here with me this evening. Regional Dean of the University of Illinois College of Medicine at Rockford, Dr. Alex Stignaro-Green, donor and honoree, Dr. Robert Ayers, and tonight's investiture inductee, Dr. Ramaswamy Kalyana Sundaram. Thank you. Thank you to this evening's speakers, Dr. Gary Rifkin and Ms. Nancy Olson. We are also delighted to honor and acknowledge Dr. Michael and Susan Glasser, for whom this professorship has been named. We are deeply grateful to Bob and Christine Ayers for their generous gift that has made this professorship possible. Endowments such as the Michael L. and Susan M. Glasser Professor of Rural Health Professions Education and Research allow our university to retain outstanding faculty like Dr. Ramaswamy, as well as assist in the recruitment of talented physicians and researchers. The foundation of our university is our faculty, those who educate our students and shape their future careers, the people who make life-changing discoveries in their research, translating them into treatments and applying that new knowledge to care for our patients in our hospital and clinics and around the world. We are committed to recruiting and retaining world-class faculty members who will advance our mission of education, research, and patient care. Named professorships recognize those faculty who represent this tradition of service and excellence. I would now like to introduce and welcome Dr. Alex Stignaro-Green, Regional Dean for the College of Medicine at Rockford. He is Professor of Medicine, Obstetrics and Gynecology, and Medical Education. He graduated from the Mount Sinai School of Medicine in 1983 and performed his residency training in internal medicine at the University of Medicine and Dentistry of New Jersey. From 1986 to 1988, he completed a fellowship in endocrinology and metabolism at the Mount Sinai School of Medicine. He also obtained master's degrees in health professions education and healthcare administration from the University of Illinois at Chicago. Dr. Stignaro-Green brings enormous strengths to the College of Medicine that are helping us improve and align our academic missions. Please join me extending a warm welcome to Dean Stignaro-Green.
Thank you, Dean Rosenblatt. Oh, it's really interesting. I'm seeing Michael and Suki off on my left here. Well, thank you for joining us tonight for this important ceremony and celebration on our campus. Professorships are a very special kind of gift. They help our students by supporting faculty members who play an integral role in students' lives as teachers and as mentors. But professorships also serve to acknowledge and honor the past and prospective achievements of individual faculty members, not just in relation to students, but also in relation to research and the creation of knowledge, which is what all faculty members at research universities strive to do. To be acknowledged in this way as worthy of a named professorship is one of the highest honors a faculty member could receive. I am now pleased to recognize Bob and Christine Ayers, for it is through their generosity that this professorship was established in the name of the Glassers. I would now like to take a little bit of time to acquaint you with the Ayers. After graduating magna cum laude from the University of Illinois Urbana-Champaign in 1976 with distinction in microbiology, Dr. Ayers enrolled at the University of Illinois College of Medicine, Rockford. In the summer of '77, the Chicago College of Medicine dean led a healthcare study trip to Russia. Dr. Ayers had just completed his M1 year in Urbana and signed up to attend. Also attending was Christine Makoviak, who had received her RN degree from the Morton Community College and was now taking undergraduate classes at the U of I Chicago Circle campus while working as a staff nurse at the University of Illinois Hospital. In 1980, they were married after Dr. Ayers completed his MD at the Rockford campus, and Christine completed her BSN from Rush University. Today, the couple have 4 children and 7 grandchildren. Upon completing family practice residency in Cedar Rapids, Iowa, Dr. Ayers purchased a solo practice in Monmouth, Illinois in 1983 from a retiring physician. He added a partner in 1989 and joined OSF Healthcare in 1994. Dr. Ayers was asked to cover the occupational medicine clinic at OSF St. Mary Medical Center in Galesburg, Illinois in 1995, and has been the full-time director there since 1997. Dr. Ayers was the Employee of the Year at OSF St. Mary in 2010 for his work leading the swine flu report, and was recognized by the Illinois Rural Health Association with the Rural Physician of Excellence Award in 2012. Christine completed her master's in nursing at the University of Iowa in 1985 with her thesis demonstrating mutagenesis in oncology nurses' urine. The couple has been dedicated to service to the university and their community. Dr. Ayers has been a member of the University of Illinois College of Medicine, Rockford's Rural Medical Education Programs Recruitment and Retention Committee since it began 30 years ago. The Monmouth-Roseville School District presented Christine and Dr. Ayers with the Distinguished Service Award, and Dr. Ayers was named the Citizen of the Year by the Monmouth Area Chamber of Commerce in 2011. The couple is also known for their philanthropy. In 2020, Dr. Ayers became a lifetime member of the College of Medicine's William W. Root Society, which recognizes people who have donated more than $100,000 with the establishment of this endowed professorship. In 2021, he received the OSF Western Regional Philanthropic Excellence Award. Dr. Ayers and his wife, parents, 4 siblings, and 3 of his 4 children are graduates of the University of Illinois programs, giving him some deep connection to our university. With the establishment of the Michael L. and Susan Glasser Professorship in Rural Health Professions, Education, and Research, that connection now becomes a legacy that will impact the University of Illinois College of Medicine, Rockford, and people around the world through the research and teaching that this professorship will provide. I would like to share one personal story about Dr. Ayers, which signifies his dedication to the College of Medicine in general and the RMed program in particular. Each year, Dr. Ayers arranges an outing with all RMed students. I've never been invited. And it's not just any outing, but it's a field trip to the Chicago Cubs baseball game. The students all board a bus from Rockford, spend a day at Wrigley enjoying the game and each other's company. The event, which is cherished by our students and I believe remembered throughout their whole career, is a direct manifestation of Bob's love of our students and his incredible dedication to RMed. Bob and Christine Ayers, we are honored to have you here and celebrate you both today. Thank you for your generosity and dedication to the College of Medicine, Rockford.
That's very kind of you. Thank you.
I got it. So, it is now my pleasure to welcome Dr. Robert Ayers to the podium, which he's here. And before we give him the opportunity to speak, we are honored to present this framed Michael L. and Susan M. Glasser Professor of Rural Health Professions, Education, and Research medallion.
Yeah, no kidding. I don't know who Dean Green was talking about, but anyway, I do want to thank you. Thanks to Dean Stagnero Green for that introduction. I'm not sure it was necessary, but Dean Rosenblatt, honored guests, U of I family, friends and guests. Today, we are privileged to recognize the leaders, or 2 leaders, of the University of Illinois College of Medicine Rockford campus. As you read their respective accomplishments, it's obvious that they are passionate about their work. These 2 represent the university well and have had an international impact in their respective fields. I'm sure it was stressful at the time, but we must recognize the importance of the advice Dr. Ramaswamy's advisor in India gave him to direct his path to Canada and ultimately Rockford. His insight saw Dr. Ramaswamy's potential and set him on a path to be a tremendous leader, mentor, and researcher. His research accomplishments alone are impressive. At the same time, he was developing the biomedical science program in Rockford. This has expanded into regenerative medicine, nanomedicine, 3D bioprinting, and his program graduated its 223rd student this month. For 30 years in Rockford, yes. For 30 years in Rockford, he has served as a mentor and inspiration for the researchers to follow. A very deserving recipient of a named professorship of education and research. Several years ago, a core group in Rockford recognized a worsening shortage of physicians in rural Illinois. This year also marks the 30th anniversary of a pilot program with 4 medical students at the RMed program on this campus. I'm humbled and a bit surprised that I was asked to be on the recruitment and retention committee since its inception. I don't know that they couldn't find anybody better or whatever. But anyway, this program has thrived, and this year graduated its 441st student, and there are 90 students currently on campus. As physicians are only one part of the healthcare team, the scope of educational programs expanded. This year marks the 20th anniversary of the establishment of the Interdisciplinary National Center for Rural Health Professions, a program Dr. Glasser directed until his retirement. Just an observation from someone on the R&R committee on how the program has evolved. During last January's interviews for the RMed class of 2027, we had more out-of-state applicants than I've ever seen before. We had kids fly in from New York, California, Texas, the Carolinas, all to come and be interviewed for our program. When asked why they applied, the answer was always the same. When they searched for rural physician medical training, U of I RMed was always at the top. So how does that go? I mean, do you say, hey Google, or hey Siri, hey, I want to do rural medicine. Where should I apply? Rockford, Illinois. What? Really? Wow, how did that happen? I want to know who found out where Siri lives and told her to tell people that. That's amazing. So it's fitting that on our 30th anniversary of the RMed program and 20th anniversary of the National Center for Rural Health Professions, we honor a founding leader with the establishment of the Michael and Susan Glasser Professorship of Rural Health Professions, Education and Research. It is my privilege to add to Dr. Glasser's legacy and simultaneously recognize the important accomplishments of Dr. Ramaswamy. So, at this time, I would ask everyone associated with the RMed program, please stand up. And now everyone with the National Center for Rural Health Professions to please stand. And everyone in the, wait just a second, everyone in the Medical Biotechnology program, including regenerative medicine, the Blazer Foundation of Nanomedicine, and the 3D Bioprinting Lab to stand. Doctors Glasser and Ramaswamy, we stand in tribute to your years of service to science and humanity. Your passion for excellence has been an inspiration for others to follow and build on. Thank you. Great job, thank you.
Well, thank you, Dr. Ayers. That was a wonderful talk and a great way to put all of this in perspective and seeing everybody stand in this room and then thinking about the scores of individuals that have been impacted through RMED and the MBT and the leadership of those two individuals is really quite striking. As an investiture, a professor is one of the most significant highlights of a faculty member's academic life. Bestowing such a position is a sign of appreciation and endorsement of the individual by the university, and a belief in the strong promise of future accomplishments. Before we formally induct Dr. Ramaswamy as the Michael L. and Susan M. Glasser Professor of Rural Health Professions and Education and Research, I would first like to highlight some of Dr. Ramaswamy's accomplishments through his careers. I'd advise you, sit back. There's a lot coming. Dr. Ramaswamy received a master's and doctoral degrees from Kerala Veterinary and Animal Sciences University in Kerala, India. As class valedictorian, he received 7 awards, including 4 gold medals, before going on to practice veterinary medicine there for 2 years. His first research publication received a national award in 1980 and was selected for India's Agricultural Research Service through a national competition. He worked as a veterinary scientist at the India Veterinary Research Institute for 7 years, and then was elected to the Canadian Commonwealth Fellowship, completing his doctorate in parasite immunology at the University of Calgary in Canada. Dr. Ramaswamy then went on to complete postdoctoral training in mucosal immunology at Cornell University in Ithaca, New York, and then joined the University of Illinois College of Medicine, Rockford in 1993 as a research assistant professor in the Department of Biomedical Sciences. He was appointed department head in 2004 and established the Master of Science in Medical Biotechnology program in 2007. The department has expanded under his leadership to include the Regenerative Medicine and Disability Laboratory, Blazer Foundation of Rockford Nanomedicine Laboratory, and a 3D bioprinting lab. Dr. Ramaswamy received his first National Institute of Health Grant Award in 1996 and has been funded by NIH continuously for the past 27 years, an incredible feat. He has served on many NIH grant review panels, published over 140 peer-reviewed manuscripts and 5 book chapters, received 7 patents, and presented at many national and international meetings. Dr. Ramaswamy is the recipient of a 2014 Fulbright Scholar Award, Distinguished Alumni Award from his Kerala alma mater, the University of Illinois Inspire Award, and the College of Medicine's Faculty of the Year Award, as well as the Faculty Distinguished Service Award and Excellence in Teaching. From my perspective, Dr. Ramaswamy is a model chair and faculty member. He has grown his Department of Biological Sciences into a vibrant center of research, excellence, and outstanding education. He is a tireless mentor of his faculty and an innovative leader creating the MBT program more than a decade ago. The MBT, by all measures, is an incredible success, with graduates receiving prestigious jobs from coast to coast. He also provides outstanding service to the College of Medicine as a whole, serving as the chair of the Faculty Promotion and Tenure Committee for more than 5 years. In 2020, Dr. Ramaswamy received the University of Illinois Chicago's Inventor of the Year Award for his tireless work in developing a vaccine for lymphatic filariasis, elephantiasis, a debilitating tropical parasite infection that affects over 120 million people, mostly in rural and developing countries around the world. Through this work, he also has developed a vaccine for heartworm in dogs. It is now my great pleasure, both personally and Dean of the University of Illinois College of Medicine, Rockford, to invite Dean Rosenblatt back to the podium for the induction of Dr. Ramaswamy.
Dr. Ramaswamy, please come forward. I don't usually get to do this. It's usually my boss, because the Board of Trustees are letting me do something on my own today. So, by the power and authority vested in me by the University of Illinois Board of Trustees, I am proud to recognize Dr. Ramaswamy Kalyanasundaram as a Michael L. and Susan M. Glasser Professor of Rural Health Professions Education and Research. It's a pleasure that we have this opportunity to bring together the university's constituents to celebrate this momentous occasion. Dr. Ramaswamy, I now invite you to accept this honor and say a few words. The script says you have 3 minutes. I suggest you take all the time that you want. You've really earned it. Dr. Ramaswamy.
Thank you, Dr. Rosenblatt. Dr. Stegner-Green, Dr. Ayers, and the respected honorable guests who are gathered here. So I'd like to thank Dr. and Mrs. Ayers for their thoughtful contribution and their continued support of the rural medicine program here at the College of Medicine. Thank you. It's a great privilege and honor to receive this wonderful recognition, especially in the name of my good friend and colleague, Dr. Michael Glasser, and his wife, Susan Glasser. So I happened to be here in the early 90s to witness the initial stages in the development of the rural medicine and the National Center and the establishment of the National Center. Dr. Michael Glasser played a pivotal role in leading and building the National Center while he was here. So thank you, Mike. And when you look at my own research, during the last 20 years, I've been trying to develop a vaccine for a disease that is present in rural parts of several parts of the world, mainly Southeast Asia, Asia, major chunk of Africa, and also in Brazil. The disease was there for centuries. Actually, people develop edema in their leg, too big for them to go to work. So these are poor people in the rural areas where they're dependent on their daily wages to run their families. And having this becomes so difficult for them to go to work. And because of this condition, actually, they are not allowed to come to work. So their family suffers, and this has been going on for centuries. So WHO wanted to have some kind of a measure to control. At that time, there was no vaccine or anything. There was some drug that is used in 1980s, which they found that it is can suppress the infection in certain areas, mainly my own hometown, where this infection was highly prevalent. So this drug was given in 1980s and found that this was substantially helping the patients. So then WHO adopted that and then started giving out this medication throughout the world, wherever this infection is, to each and every one, including children. So you can imagine several billions of doses of this drug is given every year. And they thought that the disease will be completely controlled by 2020, and this is 2023. Still nothing has happened to the infection. So they didn't know. Luckily, around 2020, I was the proponent to develop a vaccine, and nobody wanted to listen to me at that time. And WHO, there were a few people who were supporting me, but still, the major decision makers wanted to move forward with the medicine. They thought that giving away the medicine might be able to control this infection. So you can imagine several companies came forward. GSK was one of the major ones, trying to give this medication free of charge throughout the world. So they distribute this medicine. The people, everybody has to take, they have to take every 6 months to take this medication. And the people, the subjects over there, they don't know, they're not much educated. So the government goes out, sends the public health worker, and they give lessons to each people that you have to take this medication, it's important. Unfortunately, when the medicine is given, if somebody is infected, the larvae circulate in the blood, millions of them, so they all die with the medication. And when such a large number of larvae die, they ended up with anaphylactic shock. So imagine in a small community, farmers, everybody is nearby, one of the person in a house dies, then the whole community says that, okay, that medicine kills, so we are not going to take. That was what's happening over the years. And WHO did not know how to convince people to take the medication. So they asked the public health worker that you go there, take a bottle of water, make sure that you put the tablet in their mouth and give them the water and ensure that they swallow it. But even that didn't work, actually, because we visited, during my Fulbright fellowship, I visited several villages. And when we were trying to hang our mosquito net onto their sill, actually, all the medicines were there. So we asked, why didn't you take all this? So they told that they will come and force us to take. And we also asked them, they used to give you the medication to drink. So then they say that, yeah, we keep it under the tongue and then drink the water until the public health worker leaves, and then we spit it out. So, so I wrote a report to the WHO, told them, look here, this is what's happening, and you have to come up with a different measure. So now I have at least the vaccine, so why don't you think about it? Now they are actually talking to the Gates Foundation, and they are quite interested right now. But I think if they would have done it 20 years ago when we were trying to develop this, this would have been much, much far. So I'm talking about one disease. So like this, there are several diseases that never reach to the people in the rural areas. And because they don't have any money, so somebody has to put that money there. And if you go into any of those rural part of India where this, any of these infections are there, these people have no clinics, nothing. The only person visits that clinic is the public health worker. And they tell them, this is the medication I need, and probably that person brings once a week when they come. So this is the situation still. I visited in 2014. That is the situation still there. That is after 100 years. So you can imagine. So I'm hoping that at least if this vaccine comes out, it'll benefit many of the people who are suffering or who are exposed. And since the disease is transmitted by mosquitoes, there's no way to control, nobody goes out there to control the mosquitoes, so at least the vaccine could help. That's my hope, and I hope that the government will subsidize that to give it free of charge to those people who really need. So I would like to thank all my collaborators in this effort to trying to develop this vaccine, and also all the students and postdocs and all the senior people who came and worked with me over the years to develop this. And most importantly, I wanted to thank all my mentors throughout my career. My first mentor was my father, so Dr. Kalyana Sundaram. So he was my mentor for my master's thesis, so I worked under him. We published a paper, that's the paper that got the national award. So I completed veterinary parasitology under him. So he taught how to conduct research. So that's where I first learned how to do research. And my PhD mentor, Dr. Dean Beefus, at the University of Calgary, who taught me how to write successful grants and manuscripts. So he was one of the best in my life. I was able to work with him. And my postdoctoral mentor, Dr. Robin Bell, at the Cornell University, taught me how to be an independent researcher, independent investigator. So that also helped me quite a bit to establish an independent research. And of course, Dr. Bernard Salowski, who was the regional dean here at the college, who taught me how to be an entrepreneur, so in science. So he was the one who first taught me how to write patents and how to submit everything to OTM and then get that approved. And then we have a patent and a company together, which was making money. So, and Dr. Martin Lipsky, the previous regional dean, encouraged me to take challenges and showed me the path to success. So I owe to him as well. And of course, our dean, Dr. Alex Technor-Green, who believed in my leadership skills, taught me how to make major decisions that immensely helped in my own growth and also the growth of the department. So thank you. Finally, I owe all my success to my life partner, Radha, and our daughter, Priya, and her husband, Chris, for their constant encouragement and also support. So, and at this point, I know that even though this is not truly a rule, my part definitely has a big dent, not in the college, but overall throughout the globe if the vaccine do come up. And I do participate in several activities, both in India and Brazil, and also over here in terms of supporting the government over there. So thank you so much, and I accept. Thank you so much. Thank you.
Thank you, Dr. Ramaswamy. And now, as is our practice, I would like to invite individuals to make remarks about the recipient and your commitment to medicine, research, and family. First, I would like to introduce Dr. Gary Rifkin, a remarkable member of our community and our college, Professor Emeritus of Medicine and Medical Specialties at the University of Illinois College of Medicine in Rockford. Dr. Rifkin.
Thank you, Dean Rosenblatt. Before I start my formal remarks, Dr. Ramaswamy reminded me of something he didn't tell you. For all you dog lovers out there, and any of you who have lost a dog to heartworm disease, Dr. Ramaswamy's vaccine, should it be approved, will be effective in preventing heartworm disease in all dogs around this world. So that's a real accomplishment, too. Dean Rosenblatt, Dean Stagnaro-Green, Dr. and Mrs. Ayers, Ms. Olson, Dr. and Mrs. Glasser, and invited guests. We all know Dr. Ramaswamy as an incredible scientist, leader, but what's the backstory? He grew up in Trikura, a small village in India, and was at first an average student, athletics often competing with his academic studies. He enrolled in Calicut University, where academics grew in importance, but he still enjoyed sports, playing tennis, badminton, and captaining his cricket team. Dr. Ramaswamy contemplated several choices of what should follow, possibly medicine, but eventually chose to follow in his father's footsteps and enrolled in Kerala Veterinary and Animal Sciences University, graduating as valedictorian. He comes from an educated family. His father was dean of the veterinary school in Kerala. His two brothers are engineers, a family tradition, and as his grandfather was a celebrated engineer for the Indian Railway. After a Master of Science in veterinary parasitology, it was time for him to marry. As was typical of Indian families, his is an arranged marriage. He met his wife, Radha, only once before the wedding, but they've been happily married for 44 years. One thing they had in common was a love for Indian movies, not Bollywood, but Tamil movies, as that was the native tongue in their state. This was fortunate, as moving to Kerala, the state language is Hindi, and neither one spoke it. They learned by watching local movies, a skill they would employ again a few years later. Moving to Canada in 1985 on a Commonwealth Fellowship, neither Dr. Ramaswamy or Radha spoke English, and this time the TV became their language tutor. While Dr. Ramaswamy was busy earning his PhD, Radha taught elementary education, and their only child, daughter Priya, was born. After a postdoc in immunology at Cornell University, they moved to the University of Illinois in Rockford, and the rest, as Dr. Stagnaro-Green has told you, is history. When he's not in the lab bench or administering the department, he and his wife love to travel, and they've been all over the world, often meeting with their daughter Priya and son-in-law Chris after a conference and venturing together. Hawaii is one of their favorite destinations. At home, you can find them listening to classical music, watching Tamil movies with Radha, or if time permits, reading a mystery novel, possibly by Agatha Christie. He's known to others for being soft-spoken, having lots of patience, being a problem solver, good with children, and loves teaching. In 2008, I had the privilege of acting as head of the biosciences department while Dr. Ramaswamy was off to India to continue the development of his innovative vaccine for filariasis. It was probably the easiest position I've ever had, as the department ran with the precision he had established, and I was amazed at the productivity of his faculty. They believe he's a great leader, always encouraging, doesn't micromanage, and is supportive of their research. Having a head who continues to teach and write his own grants is inspiring for the faculty, as they know he understands the problems and stress that occur when grant submissions are not funded, and that he's genuinely happy when they are successful. I'm honored to call him my friend and know that Dr. Ramaswamy is an ideal choice as the Michael L. and Susan M. Glasser Professor in Rural Health Professions Education. Thank you.
Thank you, Dr. Rifkin. It's now my pleasure to invite someone who worked very closely with Dr. Ramaswamy. That's Ms. Nancy Olson, former business manager in the University of Illinois College of Medicine, Rockford. Please come forward, Ms. Olson.
Good evening. My name is Nancy Olson, and for several years, I was the business manager for the Biomedical Sciences Department and reported to Dr. Ramaswamy. When I took the business manager position, I wasn't new to the Rockford campus, but I was new to the day-to-day operations in a research lab. And at the beginning, when I was learning the job, there were times when I was overwhelmed. But Dr. Ramaswamy talked me through the responsibilities and helped me prioritize them. I leaned upon his experience in the lab and his experience in the university to help me understand my role and which duties provided the most value to the department. He showed me that staying focused on the big picture is the way to success. He consistently demonstrated through his commitment and his dedication to his goals throughout his career that led to results that will ultimately benefit countless people worldwide. Even though I'm not a scientist, I took great pride in the successes of the department because I had a chance behind the scenes to contribute to the overall success, not just of Ramaswamy's research, but the other principal investigators in the department. Despite his dedication to his work, I could see that Dr. Ramaswamy knew how to keep balance in his life. His family and his culture are very important to him. And on many occasions, I was honored and delighted to be invited to participate in cultural and family events. I always felt welcome, not only by Dr. Ramaswamy, but also by his wife, Radha, who became a good friend. So congratulations, Dr. Ramaswamy, on receiving this well-deserved honor, and I'm thrilled to be here to see you receive it, and for all the opportunities you provided for me and the guidance you gave me. Thank you.
Thank you, Dr. Rifkin and Ms. Olson. Finally, this evening, we'd like to continue to celebrate by honoring and recognizing Dr. Michael and Susan Glasser, for whom the professorship is named. Michael Glasser, PhD, retired on June 30th, 2021, after 43 years of service at the University of Illinois College of Medicine, Rockford. He was Associate Dean for Rural Health Professions, the Director of the National Center for Rural Health Professions, a research professor of medical sociology, and that Dr. George T. and Mildred A. Mitchell Endowed Professor. Dr. Glasser helped establish the nationally and internationally recognized Rural Medical Education Program, RMED, and the Interdisciplinary National Center for Rural Health Professions, NCRHP, a designated center of the Illinois Board of Higher Education at UICOM Rockford. Dr. Glasser directed the NCRHP and was co-director of the School of Public Health program on this Rockford campus. He served as principal investigator on many grants, including both the NIH-funded Project Export Center for Rural Health, supported by the National Center on Minority Health and Health Disparities, and the Kellogg Foundation's Rural People, Rural Policy Initiative. He also partnered with faculty from Maastricht University in the Netherlands to establish an international medical education externship in rural and primary care research that resulted in Dutch senior year medical students participating in an 18-week immersive rotation in collaboration with rural health clinics and hospitals. Additionally, he co-developed the Rockford Thailand International Medical Education Program, resulting in the creation of a medical school in South Thailand, and co-developed the Rural Pharmacy Program on the Rockford campus, R-Pharm. He was a founder and a director of one of the 4 American Collaborating Centers for Medical Education and Primary Health Care of the World Health Organization, Pan American Health Organization. He was also an investigator on a Health Resources and Service Administration funded program to establish a rural mental health social work track at the University of Illinois Urbana-Champaign School of Social Work. Dr. Glasser was instrumental in creating and implementing a Native American Pathway program to recruit and prepare Native American students for medical and health professions practice in their home tribal communities. He was an invited delegate to the WHO Rural Health Workforce Attraction, Recruitment, and Guidance Development Meeting in Turkey in 2022. He remains active, despite retired, in the International Organization Network towards Unity for Health, where he serves on the board of directors. He was the recipient of the University of Illinois College of Medicine Rockford's Distinguished Service Award, as well as the Faculty of the Year Award. He is also a member of Delta Omega National Honorary Public Health Society. Unfortunately, Michael and Suki cannot be with us this evening, but they've sent us a message in honor of this occasion. Can we please play the video at this point? And for those up here, feel free to come down.
Hi, this is Michael Glasser,
And I'm Suki Monroe Glasser.
and we were asked to make a few comments for Dr. Ramaswamy's investiture. First of all, Dr. Ramaswamy, Radha, Dr. Stagnaro Green, and guests, we're really glad to be able to make some comments here. And again, congratulate Dr. Ramaswamy on this investiture. I would like to start out by acknowledging Dr. Robert and Christine Ayers for their generous contribution to make this professorship possible. It's truly an honor to be recognized and have this professorship in our name. When I started at the Rockford campus back some time ago, 1978, when I still had brown hair, I would never looked at this day and really thought that this could be possible. Both Suki and I deeply appreciate the fact that we're being honored with this invested professorship in our name. Two things I've always valued in the Rockford experience are the smallness and intimacy of the campus, where faculty, staff, and students have a special relationship and mutual respect for each other. It's also a sense of camaraderie there that I really have not found in any other place, and it just always will be appreciated in my mind in terms of my experience in Rockford. To have Bob and Christine think of us and support a rural professorship in the Glasser name in this gray hair period now just reinforces my feelings of the many positive things that have come from Rockford in terms of an institution and both for me personally and professionally. This is the second invested professorship that I've been involved in. Being named the Dr. George T. and Mildred A. Mitchell Professor in Rural and Family Medicine was truly meaningful to me and carved out work for me in the rural health professions sector related to health professions education, interprofessional education, and global and international health. The Dr. Michael L. and Susan M. Glasser Professor of Rural Health Professions Education and Research, I think will similarly give the opportunity to conduct research and develop educational programs that will contribute to the health of rural people and rural communities. Finally, again, I want to congratulate Dr. Ramaswamy as a recipient of this invested professorship and I do know, he will further the health of rural populations nationally and internationally through this important rural health professorship. Thank you.
I'd also like to thank Dr. Bob and Christine Ayers for this generous gift in our name. What a wonderful honor for us. We've appreciated many enjoyable evenings with Dr. Bob Ayers, and we really value his commitment to rural education. Of course, nobody could dress up as well as Dr. Bob as the Easter Bunny. Rockford has a special place for our family. Our boys were all born either in Rockford or Harvard, Illinois, another rural area. And I taught in the Rockford Public Schools for 30 years, first as a teacher, as a literacy coach, a staff developer, and finally as the Rockford coordinator for reading in the school district. We know Dr. Ramaswamy will honor our name in this wonderful professorship, and we're excited to see how he will carry on his research in our name. Thank you.
So from the southernmost point of the U.S., again, we offer our congratulations and are happy to be able to say something on Dr. Ramaswamy's behalf.
Come and visit.
Thank you.
If you're in Key West.
Well, thank you so much to the Glassers for this heartfelt and message from a very warm place that I know quite well. Once again, want to thank Bob and Christine Ayers and all our program participants. And of course, to congratulate Dr. Ramaswamy once more. Let's give him one more round of applause. And of course, thanks to everyone for attending this very special celebration. Please enjoy the reception and the rest of the evening. We'll ask you just to stay seated as we process out.